I now have the honor to introduce our day one closing keynote, Daniel Dawes. Reading Daniel's book in 2020, The Political Determinants of Health, brought together so many strands of our work at Vot-ER. Daniel goes deep into the history of health and democracy, the moments where policy and politics have brought us big wins, and also that tremendous ground that we have yet to cover. As the executive director of the Satcher Health Leadership Institute at Morehouse School of Medicine, it is Daniel's stature and moral grounding that makes so much of our work possible at Vot-ER. He is committed to this work day in and day out and is an inspiration for us in so many ways and for so many others in this space. With that, it is a treat to introduce one of our dear advisors, mentors, and partners, Daniel Dawes.
All right, well, hopefully I have gotten this right. Aaliyah, I want to thank you so very much for that very warm welcome and the kind introduction. As you know, it's always an honor to share that virtual stage with you and to join you and Vot-ER in this movement to advance health equity and health justice for all population groups. And so I want to start off by just conveying my gratitude to you all for inviting me to speak on such a very, very important topic yet again. And it's vitally important that we continue to have these types of conversations because the work continues. Last year, when I spoke, I opened my remarks with a nod to the thousands who marched in Washington, D.C. for primarily two reasons. First was that last year's event happened to fall on the anniversary of the historic March on Washington. But secondly, and arguably more importantly, was because the March on Washington didn't end in 1963. That march, undoubtedly, one of the most impactful events in the history of our nation for protecting and advancing civil rights and liberties, as well as improving health outcomes for marginalized and minoritized groups, continue on to this day. And I have to stress that while not all movements require marches in the literal or even physical sense, they do require a concerted, organized, and sustained effort to coalesce around an idea and move en masse towards a goal. And to that end, I want to again acknowledge all of you for your presence here today and the efforts made by organizations such as Vot-ER to create and host events such as this one, and mobilize us all into action precisely in this legacy of how we can continue to advance health equity for all population groups. Because the truth be told, voting can mean the difference between life and death for all of our communities. This is why this is so critical. So we've all seen the recent headlines highlighting the everyday impact of the political determinants of health. Let these headlines wash over you for a moment. While only a year has passed since we last convened for Civic Engagement Month, much has transpired. We've seen the passing of several public policies that have affected the health outcomes of specific populations in one way or another. We've seen the struggle between our three levels of government and among our three branches of government in efforts to advance or hinder health equity. But what are the political determinants of health and how have they operated? Well, in our country, the principal roots of current and historical health inequities are found in the political determinants of health. These political determinants of health are the fundamental causes and drivers of these health inequities, and they involve the systematic process of structuring relationships, distributing resources, and administering power, operating simultaneously in ways that mutually reinforce or influence one another to shape opportunities that either advance health equity or hinder health equity. You see, these political determinants of health inequitably distribute social, medical, and other determinants, and they create structural barriers to equity for population groups who lack power and privilege. We've seen how the hierarchy of human value, as Dr. Gail Christopher has written about, evolved over time in our country, right? In our policies and processes over the last 400 years. But fortunately, we've also witnessed the impact that equity-focused policies, such as the Civil Rights Act and the Voting Rights Act, had immediately following their passage, implementation, and enforcement. In fact, in one study in 2006 that examined the effect of the 1960 civil rights laws on infant mortality rates, for instance, the authors in that study found that the concurrence of the timing, abruptness of the rate changes following 1964, the sharp decline in health disparities, right, among these groups, and the contrast with minimal changes among whites suggested that these laws were really the cause of these trends, these positive trends. The researchers estimated that between 1965 and 2002, approximately 39,000 Black infant deaths were prevented by the implementation of these laws. Now, you see, voting is what I consider to be one of the most upstream factors or determinants that play a role in determining the health of everyone's daily lives. The two other factors, as you can see on your screen, that are just as influential, of course, are government and policy. And collectively, all three are important aspects of the political determinants of health. But I'm going to focus right now on voting, right, which is our fundamental civic duty and arguably the most important aspect of the political determinants, because one, it affords us an opportunity to directly engage in and work on immediate policy solutions to the issues affecting our communities. And secondly, it installs the policymakers who will form the decisions and drive our agenda on a macro level. Voting provides us an opportunity to address long-term biological and societal consequences of the determinants of health and enables the decisions, research, programs, and policies that allow us to tackle these issues. Yet, many individuals fail to recognize or take for granted voting's impact on their health, well-being, and life expectancy. You see, a lack of civic engagement equates to a lack of voice, which means no resolution to our issues, right? A lack of civic engagement results in perpetuating the same results, which means the continuation of the inequities that already exist. It is clear then that to ensure change, we must engage as much of the voter population as possible. Americans must understand that by remaining apathetic, they're contributing to the long-term survival of these inequities, which are the very thing contributing to the deterioration of their health and beyond, and ultimately the health of this country as a whole. But the hand of these political determinants have long been weighing in on the decisions that have shaped the current state of our nation. If you think of these determinants, or you think of them just as a theoretical framework, I'm really here to tell you that they are not. In fact, I'm here today to provide you with some real-world case studies. In the first example, Ford Motor Company announced plans to open a facility near the county of Mason, Tennessee, whose residents, which were majority Black, rejoiced at the possibility of economic prosperity. Opening of the plant would create tons of jobs and was estimated to bring in almost $2 billion in state revenue. However, state policymakers aggressively tried to convince the county to give up its charter and sought to gain control of the county's finances. This would limit the ability of residents to make economic decisions to best meet their needs. And it would add increased pressure to pay back debt and cause other financial hardships for this county. Meanwhile, in the nearby county of Jellicoe, the same scenario was playing out, right? And yet was not met with the same ultimatum. From this example, we see how policies related to business interests can limit the economic opportunity of some people, stunting the growth and viability for the entire community. Notice the glaring parallels between Mason, Tennessee, and Flint, Michigan, relative to the usurpation of power by a more powerful level of government. Again, in this case, or in these cases, the state, right? Continuing on the topic of the distribution of power and resources, another real-world case study takes place in the 1920s, but still has profound impacts on folks today, when the Gila River Dam was built in southern Arizona. You see, the Tohono O'odham Indians and the Pima Indians of southern Arizona have among, if not the highest rates of diabetes, not only in the United States, but in the world. However, just 1 century ago, the deadly chronic condition was unknown to these two tribes. Over the last 100 years, the diversion of river water to upstream white settlements caused the Tohono O'odham tribe their crops, their traditional diet, livelihood, cultural and traditional celebrations and events, and ultimately their health. These intentional governmental policies that resulted in the damming of the Gila River directly impeded these tribes' abilities to grow the crops to sustain their usual, traditional, low fat and high fiber foods, right? When their crops died and there was nothing to farm, detrimental changes to active physical lifestyles also occurred. Now, adding insult to injury, the USDA then put into place policies in the 1970s and 80s that did not allow Native Americans, including these tribes, to get farm help in the form of agricultural loans during their time of extreme need. And as a result, members of these tribes who once farmed their land using river water to water their crops and nourish their soils were left to seek other employment options, which were largely sedentary jobs when jobs could even be found, quite frankly. Without access to growing their own healthy foods, members of these tribes were forced into adoption really of unhealthy processed foods. Now, while each of these case studies, as well as many others, as I'm sure you're all quite familiar with, can be neatly tucked under one of these 3 buckets that you see on your screen, the truth is there are ramifications in each situation that intersect all 3 buckets. This interplay and interdependency is what creates such a complex, intricate, and deeply rooted system we currently experience in our daily lives. Still, even though I may have recounted some very grim realities that we're facing today, I remain hopeful. You see, by my count, today, we're actually in our 4th great awakening for health equity in the United States. These awakenings include Abraham Lincoln's policy to provide health care to newly freed Black people and poor white people, the desegregation of hospitals in the 1960s, right? 2 years into the civil rights movement, a group of health equity champions said, wait a second, we better tie this movement to this larger movement. And through that movement, they were able to address the overt forms of discrimination, right, in healthcare in this country. And these, of course, are tied to the passage of the Civil Rights Act, the Voting Rights Act, Medicare, Medicaid legislation in the 1960s. The 3rd Great Awakening, though, happened with the passage of public policies addressing the more subtle forms of discrimination in healthcare, addressing minority health and health disparities. And this, of course, included all of those major laws from 1990 to 2000 to 2010, including the Affordable Care Act. And now we've entered the 4th period, right? Under the current administration, of course, which for the first time in US history is harnessing the powerful levers of the federal government to advance health equity and upstream determinants of health, right? We have never before been afforded an opportunity to prioritize and to center equity as a key priority for policymaking in this country. Well, let us not be fooled, however, into thinking that the events that have transpired over the past year are a one and done scenario. Absolutely not. Looming ahead of this long journey lies more potential setbacks that have yet to be decided on and can regress the health equity path that we've worked so diligently to forge. Because as you may have realized, within these periods where we've realized these great awakenings for health equity, where we've been able to advance the needle of health equity, there's always been these periods of retrenchment, right? And backlash to undo the gains that have been made. So after all that I've mentioned to you about the power of voting, it should come as no surprise then that curtailing voting rights is a powerful way to maintain power and drive policy agendas, despite the checks and balances that we have with our legal system. And so it's really disheartening when you think about the Supreme Court agreeing to soon hear a new elections case from North Carolina, Harper v. Hall, which could increase the power of state lawmakers over races for the presidency, Congress, and even other voting related topics, such as the power to redefine congressional maps and eliminate state courts from being able to intervene. So I ask you to consider all of the examples that I've recounted to you already, right? When answering this question, think about it for a moment. What equity and health related ramifications would this redistribution of power bring to the constituency of each state? Think about that. Well, where do we go from here? The opponents of health equity are relentless. And so we have to meet these with equal and greater efforts. By now, you'll probably guess that my first call to action is a simple yet powerful one. Vote, vote. If you are leaders of your organizations, demand that your employees get dedicated time for voting. Allow your institution to have ballot drop boxes. And just as important as it is to vote for national primaries and presidential elections, it is equally important, and if not more, to vote at local levels, as these have a direct impact to your local communities and the distribution of resources. Create symbiotic relationships with partner organizations to ensure maximum voting efforts, such as with Vot-ER. And lastly, the next call to action is one that is not so commonly thought of yet, but it's still very equally important, and that is investment. There must be a consensus, right? And large-scale effort to invest in health equity, but not just in dollar amounts. This also means investing in research that impacts health outcomes at the highest levels. Yes, on the political and the social determinants of health level. This means investing in efforts to change the narrative about the political determinants of health. And this also means investing in education and public awareness efforts, focusing on the political determinants of health. So now I want to leave you with these resounding words from an individual who has not only been a trailblazer and champion for health equity, but a model citizen who has been championing civil rights in this country all his life. And of course, I speak of David Satcher, the 16th Surgeon General and Assistant Secretary of Health, where he says that what we need now more than ever before are leaders who care enough, know enough, have the courage to do enough, and will persevere until the job is done. First, you got to care about these communities, right? But caring, as we have seen throughout the course of this nation's history, is simply not enough to effect the kind of changes that we need from a policy standpoint, right? And so you have to know enough. You have to avail yourselves of the political drivers and determinants, right, that have been wielded by those in power over time to maintain the status quo. And in knowing enough, you have to understand that this movement for health equity and health justice in the United States is not a movement for the faint of heart. It takes tremendous courage to persevere until the job is done. You know, I hope that these words by my dear friend, Dr. Satcher, continue to inspire each of you every single day when you are on the front lines championing each of your patients and continuing this fight to advance health equity in our communities across the country. I want to thank you also very much for the courageous and humbling work that you have been doing during the last 2.5 years, during this once in 100-year pandemic and this endemic, in fact. And I want to thank Vot-ER for the courageous work that you all have been doing to educate and build awareness on these critical issues. Thank you also very much. for the value of your time and your attention today.